Good morning, anatomy classes. This is a review guideline video for your test. I'm going to put that in quotation marks. It's not going to look anything like the tests you've seen so far this year. I'm not simply going to upload a document for you to work on like a worksheet or busy work. I want you to derive some knowledge that you'll be able to apply to your program areas based on the questions I've been asking you for the last few days, in order for you to make the best of the circumstances that we're in right now. I feel this is probably the best option. It's not going to take a tremendous amount of time. It's not going to hopefully take you any more time than a normal test to sit down that you would use to sit down and take a test. Sorry about that. But basically, I want you to look at the information on the review sheet, which is posted in Google Classroom, and understand it. So if there are some things on there that we didn't cover in the questioning, or maybe the short lecture that I gave you earlier in the week, go through those, understand them. Again, honor system here. I can't assess the fact that you might not understand what a couple of terms mean and you didn't bother to look them up. If you don't, just take a second, put them in a search, and if you're not sure about the answers that you're getting, just ask me. I'm very available at this time via Google Classroom or through my email or both. So make sure that you have those questions. Please ask. I've had a number of students that have been communicating with me in a regular fashion with concerns, with questions, and I do the best I can to get back to them as quickly as possible. So please use that resource that you have available to you, since we can't meet face-to-face. So looking at this review sheet, if you haven't already, pull it up on your device, whatever you're looking at, your computer screen. You can do it now, or you can do it, obviously, when you're done watching this. But there's a section of terms, like there always is, and there's a section of potential questions. So when you look at the terms, it's a shorter list. Very important to understand what these mean. And what I'm going to do when I ask the question or present the project, there's going to be some questions embedded within it. So I might generate a project or a mini project, as I've mentioned. Remember, it's a mini project. This isn't going to take you hours to complete. That's related either to fire, EMS, academy, or dental. And so obviously the dental students will get their own, and the FEA students will get their own assessment. But what I'll try to do is draw this material in as much as possible and how it would apply to you doing your job once you're either doing that job, or some of you that were already doing internships or shadowing at this point. How is this going to apply to you, this chapter? So when we look at some of the questions and some of the things we've been talking about, I can't think of a more appropriate chapter, unfortunately, to be covering right now based on what we're all going through. Immunology and the lymphatic system. How does our body stay well? How does our body, once it's infected, respond to that infection and get better? So obviously those questions that I'm going to give you are going to relate to those type of scenarios. So it's going to be a scenario-based type of project. I'm not trying to be purposely ambiguous right now. What I'm trying to do, though, is give you an idea of what to expect. So I don't need you sitting and poring over these notes and going through this review sheet. I just need you to kind of take a peek at it, have a basic understanding of it, and be prepared to utilize some of this terminology and to utilize some of the answers and responses that I've given to you to answer the questions that I'll give you in the assessment. Excuse me. So basically, understand how the lymphatic system works. And quick summary of that, the lymphatic system's job, it's a separate system of vessels. We started covering this before we actually left. It's a separate system of vessels that's very similar to the blood capillaries. But what it does is it reabsorbs that fluid that is forced out of the capillaries, the blood capillaries, that is there to nourish the cells and take away their wastes. And some of that fluid remains in the tissues. In order to recover that fluid and return it to circulation, we have to have another set of vessels, and that's what the lymphatic vessels do. The lymphatic vessels also are a great pathway or a highway for your immune cells, your white blood cells. They carry them around the body. They allow them to deeply permeate or get into tissues, fight infections. So that's why we cover lymphatic and immunology at the same time, because they're related that closely. So again, overall function of the lymphatic system is to remove excess fluids from tissues, prevent edema, which is swelling, and then the function of the immune system is to obviously help us recover or prevent infections or recover from infections. So when you look at this and some of the questions that I've asked you, like active versus passive immunity, some of the various mechanisms by which the body either prevents infection in the first place, like the barriers to entry, or the general immune responses, like the natural killer cells, versus the specific immune responses, the T and the B cells. Those are things that you have to be able to separate in your mind, and most of you did a really nice job of addressing that in the questions that I gave you. So again, when I give you this scenario-based question, scenario-based project, I will take you either into a dental office, or maybe for our EMS and fire people, I'll take you into a scenario where you're going to be dealing with a patient that might be infected with something that you need to protect yourself from. The only reason I'm not telling you how that's going to work is because I haven't quite thought exactly how I'm going to do it yet. So you'll have that hopefully within the next 24 hours, and probably that will be due somewhere, I would say, either Friday evening or sometime on Saturday. Again, at this point, I don't know what days, if days really matter at this point to any of us. I hate to say that, but that's just the reality that we're facing. I'll probably give you an extra day and probably allow you until Saturday to get this finished. So I'll have that to you either sometime later today or possibly tomorrow, and then you'll have to have it completed within the next 2 or 3 days. So that'll be the last thing that you'll have to do for this chapter, and then obviously next week we'll start addressing chapter 14. Have a good day.